Welcome to the Primaris webinar that will focus on the American Heart Association's Get With the Guidelines Stroke Registry. That's AHA GWTG. We'll probably just call it Get With the Guidelines, but this is the specific stroke registry. Want to welcome you into today's webinar. Thank you for attending. And while there are still a few others still logging in here, we'll wait just a few seconds here to really get started with this webinar. Introduce myself. I'm Jody Jackson. I'm the host of the Quality Talk podcast, and I'm hosting this webinar on behalf of Primaris Healthcare Business Solutions. Primaris has a quality data services division and team that handles chart and data abstraction for numerous clinical registries, as well as core measures, and just finishing up the very busy CMS web interface reporting season for the quality payment program. We've got a number of ACOs, large practices that depend upon us, our quality data services team, to really just kind of take on their burden of quality reporting. So looks like everybody is. Maybe we've got one or two more coming in. Already a question from Pamela. She asks, "Is Dorothy still at Primaris?" And Pamela, that's a question. I will pass along your information to Dorothy. Dorothy's handled a lot of the quality improvement organization work, quality network work at Primaris for a number of years. Other folks are coming in. There's Cameron, Kathy G. We've got good representation from the South, Alabama, Texas, New Mexico, Southwest. Up there in Minnesota, and Kathy's in Nebraska. And another one here just says somewhere in the Pacific Northwest. So we'll encourage you to reveal the mystery of your location, your identification later. So let's go ahead and get started and talk about American Heart Association's Get With the Guidelines Stroke. We have a number of topics to cover here. I'm going to give basically a higher or a ground level view of this particular registry. Let's first look at stroke and just keep it in perspective, okay? The National Institutes of Health tells us that the United States healthcare system spends, or that stroke costs our economy and our health system about $34 billion a year. That's the cost of meds, missed work, doesn't account for all of the disability costs, because stroke is the leading cause of serious disability, long-term disability in the United States. And it is the fifth leading cause of death in the United States. World Health Organization has called it a global epidemic. The cost of treating stroke in the hospital is between $9,000 and $19,000 a day. That ranges from ischemic to hemorrhagic stroke. Additional costs, of course, for meds, angioplasty, long-term rehabilitation, perhaps. So, not telling you all anything you don't already know or are aware of, but just trying to make sure we've got a good perspective here on the seriousness of stroke. And the registry measures that we're going to look at here, many of them deal with the timeliness of treatment, the door-to-needle metric of how quickly a stroke patient begins to receive clot-busting drugs. Getting to know Get With the Guideline Stroke and the Joint Commission Comprehensive Stroke. These are separate registries, and both have great value separately, and they have tremendous value together. In order to be a certified or an accredited stroke center, of course, you get that from the Joint Commission going through their comprehensive stroke program. But not all stroke centers are get with the guideline stroke um, recognized. So, as we talk about the value of get with the guideline stroke, it really, in a lot of ways, goes hand in hand with the Joint Commission comprehensive stroke because both of these together are pretty powerful. So, what is the value of either of these registries? And we could talk a lot about population health because, as with any registry, it is a population of patients with stroke, right? And uh, based upon demographics, gender, age, ethnicity, all of the variables that we can categorize stroke and patients really develops a national, and in this case, with get with the guidelines, even a global look at the demographics and the population of people with stroke. Evidence-based best practices is another value of this, and we'll touch upon this a little bit more. Because as an officially designated stroke center, the facility has already sustained and achieved numerous excellent scores for quality measures. The center's 24/7 neurology physician coverage, for one thing, that's a definite requirement and an expectation for stroke centers, and that makes the facility stand out even more. So, get with a guideline registry should also be a key in that stroke center's operational focus. It adds additional layers of recognition, prestigious awards as well as public image. And when I say public image, I see some folks responded there with smiley faces. Um, Maybe a couple of you had a frown. We may have you talk about that later. But this public image and the awards can really benefit your hospital when it comes to recruiting physicians and obviously for giving patients a clear choice based on proven quality. We also know this, we're talking about value, right? We know that insurance companies like to work with hospitals that have better patient outcomes and proven, documented, data driven results. And also, get with the guidelines provides resources, research, and training to clinicians. So it's really kind of an oversimplification, but we've done this in our blog and our podcast, talking about the difference between the Joint Commission comprehensive stroke and get with the guideline stroke. Uh, the Joint Commission registry is very system facing. It is required to have accreditation as a stroke center, and the get with the guideline registry is more patient facing. That doesn't mean that both don't do both. They are both involved with the system and patients and clinicians. But if there is a distinction, that would be one. But those observations aren't intended to diminish or undermine um, comprehensive stroke or get with a guideline stroke in any way. And in fact, the comprehensive stroke chart abstracted measures were worked out in collaboration with the American Heart Association and the American Stroke Association, as well as the Brain Attack Coalition. So there are other complex logistical and operational differences. We'll get more into those later on, and we will talk a little bit more about value-based care and where get with the guideline stroke fits in there. On to our next slide. So your stroke center also really needs get with the guidelines of stroke recognition. Already mentioned a distinction, and again, let's stress we oversimplified to say one is system facing and one is patient facing because they do both, but that makes them a little bit different. And there's also a difference. Get with the Guidelines has additional stroke measures, and we're going to look at those here shortly. Regardless of Get with the Guidelines or comprehensive stroke, there is a ton of data out there that must be put together, assembled, and documented, reporting. And there seems to be so little time, because if you're dealing with patients with stroke and treating stroke patients, unless you have dedicated staff to simply do your quality reporting, to simply do your number crunching, your data and chart abstraction, then that's really going to take away from or add to the burden of the time crunch for frontline providers, for physicians, clinicians, and the nursing staff. So we do want you to think about an outside partner for that. Obviously, as I mentioned early on, Primaris has a quality data services team that has been doing quality reporting and data and chart abstraction dating back into the mid 80s. It's not all been registries or core measures, but that's where Primaris's roots are, with value-based care, quality reporting. It used to be a physician review organization, a PRO. Primaris has decades of work as reviewing Medicare records and patient charts, to do a number of other tasks that would otherwise be burdening the health system or your healthcare team. So think about an outside partner, and we'll talk a little bit more later about what it is that Primaris can do. So what is in the Get with the Guidelines stroke database? Well, this is not just a checklist to mark and send in, of course, because if you've worked with this, that this is not only tedious, but you do learn a lot about your own practice and your patients. And one of the real benefits of this too, one of the values is you can benchmark, compare where your stroke center or your hospital stands in comparison to other hospitals. And the data does continue to show that Get with the Guidelines is closing the gap and improving the door-to-needle metric. That's often considered the top measure for stroke response, treatment, and care. And we'll delve into that just a little bit more later on. There are 7 measures that are an incentive to participate in Get with the Guidelines stroke. And these measures are embedded in the proprietary patient management tool. And that's another topic that you're going to see come up later on. Better care, better reimbursement rates is another value, another benefit of Get with the Guidelines stroke. There is obvious value in the public recognition that hospitals receive that can really be boosted via the Get with the Guidelines stroke awards and recognition. Hospitals can also take advantage of those distinctions when it comes to the task, as we said, of competing for and recruiting physicians. But there really is a bottom line dollar and cents a factor here. There's a vital connection. The insurance companies like to work with hospitals that have better outcomes. So do physicians. And so there's a very tangible, real value in that. So what about for patients? How do they benefit? Well, here's an example of how the metrics, the data abstraction and reporting can lead to quality improvement in treating outcomes. And consider dysphagia, which is a common problem for patients after an acute stroke, which can lead to hospital-acquired pneumonia. And that can increase morbidity and mortality. Dysphagia is, trouble swallowing, and this affects all sorts of other functions, swallowing, speaking, even breathing. The research has shown that the use of an emergency department dysphagia screen was associated with a significant reduction in the rates of hospital-acquired pneumonia, and that's in both ischemic and hemorrhagic stroke patients. So when we talk about benefits, the dysphagia screening is a direct outcome of research of all that population health data that has been put together through Get With The Guidelines. Let's move on to a little bit deeper dive into the measures. Now, if there are specific technical questions, we're going to be sure to get your contact information and get you in touch right away with one of our quality data services team members, one of our abstractors who do this on a regular basis. It's important to know that the specifications can change frequently, and that even happens more so with Get With The Guidelines stroke. The Joint Commission Comprehensive Stroke Guidelines can change every 6 to 12 months perhaps, but Get With The Guidelines stroke specs sometimes change monthly. And in fact, just recently there were changes in February and then again in March. So this is important to point out and to understand, because if your stroke center, your hospital is taking on this work yourselves, then who on your staff, who on that team of healthcare professionals is keeping up with those changes? And if the change requires additional training or additional resources, how quickly can you access that? And then how effectively can you share that with the rest of your team involved with abstracting this data for the stroke registries? To Get With The Guideline performance measures, as we said, there are 7 embedded in the patient management tool, and the patient management tool is from Get With The Guidelines. It's their tool. But we've got IV RTPA, arrive by 2 hour, treat by 3 hour. As you're treating patients with stroke, you're familiar with that metric. Early antithrombotics, that's the percent of patients with ischemic stroke, or TIA, who receive antithrombotic therapy by the end of hospital day 2. The other measure is VTE prophylaxis. We've also got antithrombotics, anticoagulation for AFib and AFlutter, smoking cessation, and statin prescribed at discharge. Now, this deals with inpatient stroke cases. And I want to point out the smoking cessation measure as a great example here of how a workflow issue can create a problem or make your registry reporting a lot smoother. You say, well, yeah, we ask all of our patients. They're asked, perhaps the physician, perhaps the nurse, multiple people, perhaps, are you a smoker? Maybe they provide consulting for smoking cessation. But this is an example of something that might not always be checked off or written down. You say, yeah, we had that conversation, but when you go back to look at what the record says, we find from our team, our quality data services team, has indicated to us that that's one of those measures that it's kind of like, oops. Now, internally, you had that conversation and you asked the patient, you talked about that, but it's not recorded. And if it's not recorded, then it can't go into the database that's necessary. And that's just one example. So perhaps is it a workflow issue? If you're asking the question, be sure to document, because data that's not documented is disappeared data. Somebody said that. It sounded clever. The Joint Commission Comprehensive Stroke, there are 3 measures for acute stroke ready inpatient There are 2 measures for acute stroke-ready outpatient, and then we've got a dozen more comprehensive stroke. It ranges from timeliness of reperfusion to severity measurement to median time to revascularization, um, arrival time to skin puncture, the door to needle. So many of these measures are similar, but there are some big differences, which is why it's going to be really important to be involved in both of these. Mention the stroke management tool. We already identified some of the comprehensive stroke chart abstraction measures, and we can be sure to provide the latest resources and links for those to everyone who is viewing this webinar. So let's look at some questions and answers from the field. We asked our own data abstraction team what sort of questions they get and how in the world would you answer those? So one question is simply, what are the benefits of participating in this registry? And we did talk a little bit at length initially when we started this about some of the benefits. It can help with recruiting physicians, it boosts your public image, helps patients have a clear choice on quality, and your clinicians, your hospital has access to American Heart Association, Get With the Guidelines Stroke research, other resources, and this is valuable that otherwise you wouldn't have. So how do I get started in this? Well, let's go back to some of the benefits here. Because proven patient education materials provided by American Heart Association is vital. You can participate and benefit from current research based on data reported, as we've said, and there's collaboration with the Joint Commission on accreditation and certification. So Get With the Guidelines Stroke can stand on its own. Joint Commission Comprehensive Stroke can stand on its own. These are best when they are in tandem, when they're together. So if you have a question about getting started, we're going to provide a link to guidelines and a video, and also the email address for your local Get With the Guidelines representative. And it would be good to speak with them. You want to know, and a couple of you already asked this question too. Charles and Elaine have wondered, waiting for this answer, can Get With the Guidelines integrate with my current abstraction software? Well, the firm answer is maybe, possibly. You Get With the Guidelines has cooperative agreements with several software vendors, but Primaris can help guide you through the process of integrating your data from multiple registries and finding the most appropriate solution for your organization. And we have a question that Charles has asked, well, is Primaris an IT company? I don't think it is. No, you're correct. Primaris is not an IT company. We're not a software company. We're a data abstraction, chart abstraction company. But our team members are qualified, highly trained, and can access scores of electronic medical record systems. And they also have the latest training in manual chart abstraction, because many registries still require some of the data that comes from physicians' notes, charts maybe, that aren't necessarily in the electronic record. But when we say medical chart, we're really talking about all of the record, whether it is still in maybe some paper form or whether it is electronic. And what is the patient management tool? I think we've already addressed that. That particular tool helps to track those additional Get With the Guidelines measures. Now, you might say our stroke team is clinicians with full-time duties. How in the world do we do this ourselves? Well, there are some steps you can take. Of course, the patient management tool is helpful for your staff taking this on themselves. But, our first answer is going to be, hey, let Primaris help. We can abstract the data straight from your EMR and return you actionable data about your biggest opportunities for improvement. For instance, we can provide case-by-case reports with your opportunities for improvement, your OTHs, so you can determine, for example, if your priorities are last well-known, if you need better documentation on last well-known, better documentation on smoking cessation, transfer times, or simply documenting the timeline of the stroke. So you ask, what are some common pitfalls? Where are we likely to hit a snag? Well, we mentioned last well-known. There are myriad ways that metric can be documented, as well as correctly classifying and abstracting the etiology, the timeline of strokes. And it's also vital to abstract the stroke timeline to the exact specifications. And considering that the specifications routinely change much more quickly with Get With The Guidelines, that's a pitfall if you're not prepared to stay on top of that. If you still have questions, you can, you see the little website there at the bottom, primaris.org. You can also email engage@primaris.org, and you can get in touch with us that way. And you're going to also receive a follow-up communication from us anyway, because you are part of this webinar and you're staying to the very end, so you get an extra bonus. Now you're wondering, what is the bonus? So I'm going to take a quick break here because earlier it was Dr. Dave who identified somewhere in the Pacific Northwest. And so I've seen Terrence. Hi, Terrence. Terrence simply says his question is Bigfoot. and the and then Jeanette says, well, maybe Bigfoot, but maybe have you seen D.B. Cooper? So I hope you all know that by referencing D.B. Cooper, which I understand perfectly, but we're kind of aging ourselves a little bit there. And I hope that some of you are kind of scratching your heads, who's D.B. Cooper? And you can go to the magic Google, I guess, find out more about D.B. Cooper, who's maybe still on the lam somewhere in the Pacific Northwest. But Dr. Dave, I don't think anybody is accusing you of being D.B. Cooper. All right. American Heart Association, Get With The Guidelines, Stroke, Transforming Care. There is pretty clear evidence that this is happening. Get With The Guidelines has facilitated the dissemination of new findings in stroke research that has led to what modern healthcare called the rapid translation of new findings into clinical practice. I'm sorry, that wasn't modern healthcare, that was health affairs. Get With The Guidelines studies have also led to new interventions. For instance, hospitals had suboptimal rates of TPA administration within 60 minutes, and they had variation in timeliness of TPA initiation. Get With The Guidelines studies have influenced expansion and improvement of those times, and expansion of the patient population eligible for TPA. So there's real-time and not just practical, but life-saving data and measures that come from this. And there's a little bit more. Let's look at a little bit more of supporting studies and data. Get With The Guidelines studies led to the development of novel validated risk scores and mortality models for both ischemic and hemorrhagic stroke. And that aids better understanding of case fatality rates. Other studies have identified opportunities for improvement in hospital pre-notification and EMS diagnosis, rates and risks of procedures and inpatient complications, and discharge processes. So there's, when we talk about transforming care, there's evidence that that's happening. So let's talk about whether this is a DIY project, do it yourself, or is expert help needed? DIY is all the rage. My wife and I, for instance, have a DIY. We'd like to watch DIY Network. Any other DIYers out there? Yeah, everybody raises their hands. Most of you raise your hand like to do a DIY project. Okay. Elaine put triple exclamation marks there. Okay, so Elaine loves to do DIY, or else that means you don't like to make it DIY when you're doing get with the guideline stroke, because your team already does wear a lot of hats. We've tried to come up with different ways to visualize and illustrate and explain the whole concept of all of the different jobs that your healthcare team has. And it keeps coming back to you wear a lot of hats. Patient care, administrative stuff, charting and coding, and golly, you have time then to do chart and data abstraction. This is very time consuming and it's complex. Simply the fact that the measures change frequently, that's a real drain on your time and your resources. At Primaris, our quality data services team, they have collaborative team meetings. It's either weekly or every other week where they actually all get on a call together and they talk about what's been happening and what changes they're seeing, what snags they're running into, what successes they're having, and this is a great learning opportunity internally, and it's often things that they can share. There's a number of sets of guidelines, obviously with comprehensive stroke, as well as with get with the guideline stroke. And if your healthcare team is also responsible for doing data abstraction for other registries and core measures, for instance, or any other quality program, they have their own sets of guidelines. And yeah, they change how often. And I see Elaine did say triple exclamation mark meant, yeah, this is a tough measure. This is a tough registry to do DIY for. Chart extraction and data mining. We've really generally talked about an overview of the abstraction process, the measures that are looked for, what happens if things aren't charted correctly or if maybe not even recorded at all. One of our popular blog posts in our registry series is the mysterious case of the missing data. When it comes to reporting your measures and your data to the registry, whichever clinical registry it is, the real snag there is if you're missing any data. And so having an outside partner like Primaris is a great way to avoid that problem. And we do feel your pain. Our quality data services team members, for the most part, are former or current frontline professionals, nurses, people who've been where you are. And perhaps in many cases, we know the wearing a lot of hats analogy because they've described it to us as that. Now that they are part of our QDS team, and they look and see, dealing with the partners that we have now, they really can say, we feel your pain. We're going to recap how Get with the Guideline Stroke is closing the gap. We've talked about some studies and data that indicate, show that it's effective and it is transforming care. There's the patient management tool, Get with the Guideline award recognition. It's complex and time consuming, and it's helpful to seek outside help. So let's real briefly, though, kind of rewind, I guess, and look at the importance of this sort of registry reporting. Get with the Guideline Stroke hospitals continue to provide higher level of care even after the reporting period or the recognition is given. The studies show that these hospitals really develop or just continue to provide a higher level of care. And perhaps a lot of this is because they've developed quality as a business model. quality isn't just a box you check. There's all these check boxes and all these data points and just a ton of things you're required to document. Um, and I know sometimes it just seems like it's a point and click, point and click, point and click, and you're checking off boxes. But when you see this as a business model, and the quality initiation starts from the top, and it becomes part of your organization's culture, then it's going to be successful. And that just gives it a little bit different perspective. So we want to talk again about the value of outsourcing, because if quality is the work and not an extra chore, if your frontline workers, if it's simply an extra chore to them, and you want to do it well, you want to do patient care well, and you want to update and keep your medical training um, as current as possible and even higher, then sometimes this registry work can really seem like it's just something extra to do. So maybe one of the best ways to make sure that this is the work is to recognize the value of outsourcing. That brings us to the end of this webinar. We've really touched a lot of different topics. Are there any questions out there? Okay, what are the Get with the Guidelines award programs? And I'm glad you asked that, because we did kind of skim over that, but didn't get into it enough. So there are a number of different levels, achievement awards that are part of the Get with the Guidelines stroke recognition. They include Silver Plus, Gold Plus Quality Awards. These are advanced levels of recognitions that really applaud hospitals for consistent compliance with quality measures that are part of that patient management tool that we talked about. We can provide you with the download for the Silver Plus and Gold Plus Quality Award. There's an FAQ, a PDF that we will include as a resource with this webinar. Just as a little bit of background, then, the new program provides an additive incentive by recognizing hospitals that meet 75% compliance on any 4 additional quality measures. And that can include dysphagia screening, stroke education, door to TPA time within 1 hour, door to needle time, documentation of LDL cholesterol, intensive statin therapy, and last well known. So if you can meet 75% compliance on any 4 of those, then you can achieve a higher award. The different tiers of awards, the different levels and requirements or qualifications, those are get into need a little bit higher technical explanation on how to do all those. But that should give that's a pretty good one. All right. Francine says, thank you so much. You're looking more forward for more information. So we have your registration information, and we'll be sure to get you links from that. And ta-da, bonus offer. Here's our free ebook, Get with the Guidelines Stroke. What you need to know. This is an ebook that we're happy to provide you now as a result of your registration, and you're sticking with us to the end of this fine webinar. Remember, Primaris takes care of your data so you can take care of what you care most about, your patients. And here's how to get in touch with us. Our mailing address, phone number, email address, marketing@primaris.org. That is preferred. I said earlier, engage@primaris.org. We monitor both of those. So we look forward to hearing back from you, and look forward to also participating in future registry webinars. Our most recent previous webinar was on the American College of Surgeons NSQIP registry and program. So if you're interested to know more about that, we can make sure that you get that information as well. Again, my name's Jody, and I appreciate everybody being with us. It's been a good, lively crowd. I've really enjoyed seeing you all communicate back and forth with each other. It looks like a lot of common birds of a feather here, even though we've gone from coast to coast. And I think we had a couple of folks in international lands who participated. Somebody in Brazil. That's pretty cool. So again, my name's Jody with Primaris. Remember, Primaris is your partner in healthcare quality. Bye for now.